blood is made up of red blood cells, white blood cells and platelets in a liquid called plasma. Blood group is determined by inherited antigenic substances on the surface of red blood cells. These antigens may be proteins, carbohydrates, glycoproteins, or glycolipids, depending on the blood group system. Some of these antigens are also present on the surface of other types of cells of various tissues. Almost always, an individual has the same blood group for life, but very rarely an individual's blood type can be changed through addition or suppression of an antigen, like an infection, malignancy, or autoimmune disease. Another more common cause of blood type change is a bone marrow transplant, which is performed for many leukemias and lymphomas. The ABO blood group system involves 2 antigens and 2 antibodies found in human blood. The 2 antigens are antigen A and antigen B. The 2 antibodies are antibody A and antibody B. The antigens are present on the red blood cells, and the antibodies present in the serum or plasma. With regard to the antigen property of the blood, all human beings can be classified into 4 blood groups. Those with only antigen A are grouped as group A blood type, those with only antigen B are grouped as B, people with both antigen A and B are grouped as blood group AB, and those with neither antigen are called group O. As I stated earlier, a BO blood group system involves 2 antigens and 2 antibodies, so people always process antibodies for the lacking antigen in red blood cells. Hence, people with blood group A have antibody B, group B have antibody A. As people with blood group AB have both antigens, they do not have either A or B antibodies. In opponent, group O people have both antibody A and B, as they do not have either A antigen or B antigen. The rhesus or Rh blood group system is the second most significant blood group system in human. The most significant Rh antigen is the D antigen. The presence or absence of the Rhd antigen is signified by the positive or negative sign. Usually, a BO and Rh blood group in combination is used to express the blood group of a person. For an example, person with ABO type A blood and does not have the Rhd antigen is expressed as A negative blood group. Unlike ABO blood group system, Rhd negative individuals do not have any anti-DIgG or IgM antibodies. However, D negative individuals can produce IgG anti-D antibodies following a sensitizing event, like a feto-maternal transfusion of blood during pregnancy. Now, you may think how to check your blood group? It's a simple test based on an agglutination reaction. When red blood cells carrying one or both the antigens are exposed to the corresponding antibodies, they interact with each other to form visible agglutination or clumping. Blood grouping test can be divided into 2 parts, known as forward grouping and reverse grouping. During forward grouping, 1 drop of antisera containing antibody A, B, and D is reacted with 1 drop of patient blood cells. After mixing, agglutination was observed for clumping. During reverse grouping, 2 drops of patient's serum was mixed with 1 drop of A, B, and O reagent cells. Here again clumping is observed. Combination of forward and reverse grouping results were used to conclude the blood group of the person. In this case, it is B positive. Blood grouping is critical in blood transfusion, hemolytic disease of newborn and many other cases. Hope you learned something during this episode. Until next, bye for now.